Module number 3. Physical Conditions of Abnormal Psychology. The physical conditions of abnormal psychology. Abnormal psychology is a branch of psychology that explores the various factors contributing to mental disorders and aberrant behavior. While psychological and environmental factors play significant roles in the development of these conditions, it is essential to recognize the crucial influence of physical conditions on abnormal psychology. The brain serves as the epicenter of our cognitive and emotional processes. Any abnormalities in its structure or function can lead to mental disorders. Conditions such as traumatic brain injuries, tumors, and neurodegenerative diseases like Alzheimer's can impair cognitive functioning, causing changes in mood, behavior, and thought processes. Additionally, imbalances in neurotransmitters such as serotonin and dopamine are associated with various mental disorders, including depression and schizophrenia. Genetic factors can significantly influence a person's susceptibility to mental disorders. Research has revealed that certain genes may increase the risk of conditions like bipolar disorder, schizophrenia, and major depressive disorder. These genetic predispositions interact with environmental factors, highlighting the complex interplay between genetics and the environment in the development of mental disorders. Hormones produced by the endocrine system have a profound impact on mental health. Disorders of the endocrine system, such as thyroid dysfunction or adrenal gland disorders, can lead to symptoms resembling mental disorders, including mood swings, anxiety, and cognitive deficits. Additionally, hormonal changes during puberty, pregnancy, and menopause can trigger or exacerbate mental health issues in susceptible individuals. Understanding eating disorders. Eating disorders are complex mental health conditions characterized by unhealthy eating behaviors, preoccupation with food, body image concerns, and emotional distress. They affect millions of people worldwide and can have severe physical and psychological consequences. One of the most prevalent eating disorders is anorexia nervosa. Individuals with anorexia often have an intense fear of gaining weight, leading them to restrict their food intake drastically. This can result in severe malnutrition, physical weakness, and a distorted body image where they perceive themselves as overweight despite being underweight. Bulimia nervosa is another common eating disorder characterized by recurrent episodes of binge eating followed by compensatory behaviors such as vomiting or excessive exercise. People with bulimia may maintain a relatively normal weight but suffer from physical complications related to purging behaviors. Binge eating disorder, BED, involves recurrent episodes of uncontrollable overeating without compensatory behaviors. Individuals with BED may be overweight or obese, facing health risks like heart disease and diabetes. The causes of eating disorders are multifactorial. Genetic predisposition, societal pressures for an ideal body image, low self-esteem, and psychological factors like anxiety and depression can contribute to their development. Traumatic experiences, societal expectations, and family dynamics may also play a role. Early intervention is crucial in treating eating disorders. Cognitive behavioral therapy, psychotherapy, nutritional counseling, and medical supervision are some of the treatment options available. Support from family and friends is also essential in the recovery process. Binge eating disorders. Understanding the complex connection. Binge eating disorders represent a significant public health concern worldwide, affecting millions of individuals, predominantly women, across diverse age groups. Binge eating is a phenomenon characterized by the consumption of an excessive amount of food within a short period, often accompanied by a loss of control over eating behavior. Binge eating is at the core of several eating disorders, most notably binge eating disorder, BED, which was officially recognized as a distinct disorder in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, in 2013. While binge eating can be a symptom of various eating disorders, BED is characterized by recurrent episodes of binge eating, typically occurring at least once a week for 3 months, without the compensatory behaviors seen in bulimia nervosa, such as vomiting or excessive exercise. Binge eating often emerges as a response to emotional distress, such as stress, anxiety, depression, or low self-esteem. The act of overeating provides temporary relief, serving as a way to numb or cope with negative emotions. Genetics play a role in predisposing individuals to eating disorders, including binge eating. Research has suggested that certain genes may increase susceptibility to these disorders, although environmental factors also interact with genetic predispositions. Societal pressures to achieve unrealistic beauty standards, which often glorify thinness, can lead to body dissatisfaction and drive individuals to engage in disordered eating behaviors. Peer pressure and social media can exacerbate these influences. Binge eating and eating disorders can have severe physical consequences, such as obesity, diabetes, heart disease, gastrointestinal issues, and nutritional deficiencies. The cycle of overeating followed by guilt and restriction can wreak havoc on the body's metabolism. Individuals with binge eating disorders often experience profound guilt, shame, and embarrassment, which can worsen their mental health. Depression, anxiety, and social isolation are common psychological consequences. The secrecy and shame associated with binge eating disorders can lead to strained relationships and social isolation. Affected individuals may avoid social events to hide their eating habits. Treating binge eating disorders and associated eating disorders requires a multidimensional approach. Cognitive behavioral therapy, CBT, is effective in treating binge eating disorders by helping individuals identify triggers, develop healthier coping mechanisms, and modify their eating behaviors. Some medications, such as selective serotonin reuptake inhibitors, SSRIs, have been used to manage binge eating disorders, particularly in cases where co-occurring depression or anxiety is present. Registered dietitians can help individuals establish healthy eating patterns and repair their relationship with food. Joining support groups or therapy groups with individuals facing similar challenges can provide a sense of belonging and reduce isolation. Understanding sleep disorders. Sleep is a fundamental aspect of human existence, essential for physical health, mental well-being, and overall quality of life. However, for many individuals, sleep does not come easily due to the prevalence of sleep disorders. Sleep disorders encompass a wide range of conditions that disrupt the normal patterns of sleep, leading to difficulties in falling asleep, staying asleep, or achieving restorative rest. One of the most common sleep disorders is insomnia, characterized by persistent difficulty falling asleep or staying asleep. Stress, anxiety, and lifestyle factors often contribute to its development. Another common disorder is sleep apnea, where a person experiences brief interruptions in breathing during sleep, leading to poor sleep quality and excessive daytime fatigue. Sleep apnea can have serious health consequences, such as hypertension and heart disease. Narcolepsy is a less common but intriguing sleep disorder characterized by sudden and uncontrollable episodes of falling asleep during the day. It results from a disruption in the brain's regulation of wakefulness and sleep. Restless leg syndrome, RLS, is another condition that causes uncomfortable sensations in the legs and an irresistible urge to move them, often disrupting sleep. Parasomnias, including sleepwalking and night terrors, involve abnormal behaviors or experiences during sleep. These disorders can be distressing for both the affected individual and their sleep partners. Sleep disorders can have far-reaching consequences. They can lead to impaired cognitive function, mood disturbances, and an increased risk of accidents and injuries. Moreover, the chronic sleep deprivation associated with these disorders can contribute to the development of chronic health conditions like obesity, diabetes, and cardiovascular disease. Insomnia and anxiety, a complex relationship. Insomnia and anxiety are two common and often interrelated disorders that can significantly impact an individual's physical and mental well-being. Insomnia is characterized by difficulty falling asleep, staying asleep, or experiencing non-restorative sleep, while anxiety refers to a state of excessive worry, fear, or unease. Insomnia and anxiety often go hand in hand, creating a vicious cycle that can exacerbate both conditions. The relationship between these two disorders is bidirectional, meaning that each can lead to and worsen the other. Anxiety can make it challenging to relax and fall asleep, leading to insomnia, while chronic insomnia can increase feelings of stress and anxiety, further perpetuating the cycle. Stress is a common trigger for both insomnia and anxiety. High levels of stress can activate the body's fight or flight response, causing increased heart rate and alertness, making it difficult to sleep or relax. Psychological factors such as past trauma, excessive worry, and perfectionism can contribute to both insomnia and anxiety. Individuals with these traits may find it challenging to quiet their minds at night, leading to sleep disturbances. Certain medical conditions, such as chronic pain, hormonal imbalances, and respiratory disorders, can disrupt sleep patterns and contribute to anxiety. Some medications, particularly stimulants and certain antidepressants, can interfere with sleep and contribute to anxiety. The coexistence of insomnia and anxiety can have a profound impact on an individual's mental health. Chronic sleep deprivation due to insomnia can exacerbate anxiety symptoms, making it more challenging to manage the underlying anxiety disorder. Furthermore, the fatigue and irritability resulting from poor sleep can diminish an individual's ability to cope with stress and emotional challenges, leading to a heightened sense of anxiety. CBT is an effective treatment for both insomnia and anxiety. It helps individuals identify and challenge negative thought patterns and develop relaxation techniques to improve sleep quality and reduce anxiety. Medications may be prescribed in some cases to alleviate symptoms. For insomnia, sleep aids or medications that target the underlying cause, such as anxiety or pain, may be used. Antidepressants and anti-anxiety medications can be effective in managing anxiety. Adopting healthy sleep hygiene practices, such as maintaining a consistent sleep schedule, avoiding caffeine and electronics before bedtime, and creating a relaxing bedtime routine, can improve sleep quality and reduce anxiety. Techniques like mindfulness meditation, deep breathing exercises, and progressive muscle relaxation can help individuals manage stress and reduce anxiety, which in turn can improve sleep. The intricate dance of mind and body, psychological factors influencing biological processes. Psychological factors can significantly influence biological processes, showcasing the intricate and interconnected nature of the human mind and body. This phenomenon, known as psychosomatic interaction, underscores the vital role that our mental and emotional states play in shaping our physical health and well-being. Several key scenarios illustrate how psychological factors impact biological processes. Firstly, stress serves as a prime example of how psychology influences biology. When individuals experience chronic stress, their bodies release stress hormones like cortisol and adrenaline. Prolonged exposure to these hormones can lead to a range of health problems, including increased blood pressure, weakened immune function, and even cardiovascular disease. Stress can also affect digestion, causing issues such as irritable bowel syndrome. Secondly, the placebo effect demonstrates the power of the mind over the body. When people believe they are receiving a beneficial treatment, their bodies often respond positively, even if the treatment lacks therapeutic properties. This showcases how expectations and beliefs can influence biological responses, such as pain perception and immune system activation. Furthermore, the field of psychoneuroimmunology explores the links between psychological factors, the nervous system, and the immune system. Studies have shown that emotions like depression and anxiety can weaken immune responses, making individuals more susceptible to illnesses. Denying the seriousness of a medical condition, a dangerous response. Denying the seriousness of a medical condition is a response that can have grave consequences for both the individual affected and those around them. This response often manifests as a coping mechanism, a defense mechanism, or simply a lack of awareness. Regardless of the underlying reasons, it is a perilous stance that can hinder timely diagnosis, appropriate treatment, and emotional support. One common reason for denying the seriousness of a medical condition is fear. People may be afraid of facing the harsh reality that accompanies a severe illness or condition. Denial allows them to momentarily escape the distressing thoughts and emotions associated with their diagnosis. However, this escape can be fleeting, leading to delayed treatment and worsening symptoms. In some cases, individuals might even engage in behaviors that exacerbate their condition, such as avoiding medical appointments or neglecting prescribed medications. Another reason for denying the seriousness of a medical condition is a lack of awareness or understanding. Some people may not fully grasp the implications of their diagnosis due to limited health literacy or inadequate information. They might dismiss symptoms as minor inconveniences rather than recognizing them as warning signs of a more significant issue. This ignorance can be compounded by societal stigmas surrounding certain illnesses, causing individuals to downplay their condition out of shame or embarrassment. Denying the seriousness of a medical condition can also be a defense mechanism to maintain a sense of normalcy in one's life. Acknowledging the severity of an illness might mean making significant lifestyle changes, which can be emotionally challenging. Thus, some individuals choose to ignore their condition to avoid disruption to their daily routines and relationships. Understanding Alzheimer's disease. Alzheimer's disease is a devastating neurodegenerative disorder that primarily affects the elderly population, characterized by progressive cognitive decline and memory impairment. First identified by Dr. Alois Alzheimer in 1906, the disease has since become a significant global health concern. The hallmark of Alzheimer's disease is the accumulation of abnormal protein deposits in the brain, specifically beta-amyloid plaques and tau tangles. These abnormal protein aggregates interfere with the communication between brain cells, leading to their dysfunction and eventual death. As a result, affected individuals experience a decline in cognitive functions such as memory, reasoning, and language skills. The exact cause of Alzheimer's disease remains unclear, but it is believed to involve a complex interplay of genetic, environmental, and lifestyle factors. Age is the most significant risk factor, with the risk increasing significantly after the age of 65. Genetics also play a role, as individuals with a family history of the disease are at a higher risk. Common symptoms of Alzheimer's disease include forgetfulness, difficulty with problem solving, confusion about time and place, and changes in personality and behavior. As the disease progresses, individuals may struggle with basic activities of daily living, such as dressing and feeding themselves, and may eventually become completely dependent on caregivers. Alzheimer's disease has a profound impact on both individuals and society. It places a heavy emotional and financial burden on families and caregivers. Additionally, the cost of healthcare and long-term care for Alzheimer's patients is substantial, straining healthcare systems worldwide. The progression of cognitive deterioration in neurocognitive disorder due to Alzheimer's disease. Neurocognitive disorder due to Alzheimer's disease, AD, is a devastating condition that primarily affects cognitive functions. This progressive disorder follows a well-defined trajectory of cognitive deterioration characterized by distinct stages. Understanding this progression is crucial for patients, caregivers, and healthcare professionals to provide appropriate care and support. The earliest stage of AD, often referred to as preclinical or mild cognitive impairment, MCI, due to AD, is marked by subtle cognitive changes. Individuals may experience memory lapses, difficulty with word finding, and mild disorientation. These symptoms are often overlooked or attributed to normal aging. As AD advances, it enters the mild stage, where cognitive deficits become more pronounced. Memory impairment worsens, and individuals may struggle with daily tasks, such as managing finances or following a familiar recipe. Language difficulties and impaired judgment may also emerge. Friends and family may notice these changes, prompting medical evaluation. The moderate stage of AD represents a significant decline in cognitive function. Memory loss becomes severe, and individuals may no longer recognize loved ones. Communication challenges intensify, and behavioral issues like agitation and aggression can occur. This stage typically necessitates professional caregiving due to the inability to perform essential activities of daily living. In the severe or late stage of AD, cognitive deterioration reaches its zenith. Individuals lose the ability to speak, recognize others, or control bodily functions. They become entirely dependent on others for care and are at risk for medical complications. The progression of cognitive deterioration in AD is associated with the accumulation of amyloid plaques and neurofibrillary tangles in the brain, leading to widespread neuronal damage. While treatments can alleviate some symptoms and slow the progression, there is currently no cure for this devastating disease. Forms of amnesia. Depersonalization derealization disorder, DPDR, and dissociative amnesia are two distinct but related mental health conditions that fall under the broader category of dissociative disorders. While both involve a disconnection from one's sense of self or surroundings, they differ in several key ways. Depersonalization derealization disorder is characterized by persistent and distressing experiences of depersonalization, feeling detached from oneself, and derealization, feeling detached from the external world. Individuals with DPDR may feel like they are observing themselves from outside their bodies or that the world around them is unreal. These experiences can lead to significant distress and impairment in daily functioning. On the other hand, dissociative amnesia is primarily characterized by memory loss, often related to a traumatic event. Individuals with dissociative amnesia may forget significant portions of their past or even their entire identity. This memory loss is typically not due to neurological damage, but rather a psychological defense mechanism to cope with overwhelming trauma. One key difference between the two disorders is their primary symptomatology. DPDR primarily involves alterations in perception and self-awareness, while dissociative amnesia centers on memory disruptions. Additionally, DPDR tends to be chronic and ongoing, whereas dissociative amnesia can be more episodic, with memory gaps typically related to specific traumatic incidents. Treatment approaches also differ. DPDR is often addressed through psychotherapy, particularly cognitive behavioral therapy, CBT, and dialectical behavior therapy, DBT, with a focus on grounding techniques to reconnect individuals with their sense of self and reality. Dissociative amnesia, on the other hand, may require a combination of therapy and approaches to help recover lost memories, such as hypnotherapy or eye movement desensitization and reprocessing, EMDR.